So for our project, we did the muscles of the pectorals major and minor, the rotator cuff, which includes 4 muscles, the abdominals, which also includes 4 muscles, the iliacus, and the psoas major. So with the pectoralis minor or pectoralis major, the origin is the medial half of the clavicle, sternum, and the upper 6 costal cartilage. So if you look to the picture, you can see that there's stars placed on where the origins can be. In addition to this, the insertion is the lateral side of the bicep groove of the humerus bone. Some actions can include adduction, flexion, and the medial rotation of the arm. And in the next slide, we're going to show some exercises. So these can include bench press, incline bench press, and push-ups. So with this video, it's incline dumbbell bench press, and you can see the models going all the way down, and you can adjust the weight if needed, depending on your mobility and your ability to perform the exercise. Additionally, there's also push-ups. You can do close grip, further away push-ups, and in this case, we did just a regular push-up. The pectoralis minor is also a muscle included. All of these muscles work hand in hand, and the pectoralis minor, the origin is the 3rd, 4th, and 5th rib, and you can see the stars located. Additionally, the insertion is the anterior border of the Moraca process of the scapula. Some actions include the draws of the scapula forward and downward. And then again, exercises include close grip push-ups, single arm dumbbell bench press. So with this video, it's a single arm dumbbell bench press, and the model is demonstrating that you go all the way down in a 90-degree angle, and you can adjust your weight if needed, or the amount of reps if needed as well. And with this one, there's a close grip push-up, and these all target the same pectoralis minor and major muscle. We also included the subclavius muscle. This muscle was not included in the presentation, but we thought that it would be beneficial to include it since it is a part of the pectoralis major and minor. This one, the origin is the upper surface of the 1st costal cartilage. And then the insertion is the middle and 3rd of the inferior surface of the clavicle. Actions include depresses of the clavicle, steadying the clavicle and during the movement, and another exercise is the bench press. So the model demonstrates the bench press, and again, you can adjust your weight if needed, and your reps based on what your mobility is.
The teres minor is one of the 4 rotator cuffs, and the lateral border of the scapula is the origin, which is indicated by the red star. The insertion is the greater tubercle of the humerus, which is indicated by the blue star. Actions of this muscle include arm external rotation, arm adduction, and it stabilizes the humeral head. Exercises include inverted row, face pulls, and chin-ups, and single arm dumbbell row. In the next slide, we have demonstrated face pulls. As you can see, the model pulls their arms back and squeezes her shoulder blades together in the back. The inverted row, she uses the barbell and with an over the hand grip, and as she pulls, she squeezes her shoulder blades back as well. The supraspinatus is the next rotator cuff muscle. The origin is the fossa of the scapula, which is indicated by the red star, and the insertion is the greater tuberosity of the humerus and the superior facet, indicated by the blue star. The actions include abduction of the arm from 0 to 15 degrees as the main agonist, and it also assists in deltoid to produce abduction up to 90 degrees. Some of these, the exercises could be sword cable pulls, medicine ball, or incline push-ups. In the next slide, we have sword cable pulls or band pulls. You can do either. You just start with one hand down by your pocket and you pull like you're about to draw a sword out of your pocket. Incline push-ups, you can use a desk, a chair, anything really. And you just want to set your elbows back and push up as normal. The infraspinatus is the origin is the fossa of the scapula, which is indicated by the red star. And the insertion is the posterior aspect of the greater tuberosity of the humerus and the capsule of the shoulder joint, which is indicated by the blue star. These actions include main external rotator of the shoulder joint, and it also assists in shoulder extension. Exercises include banded no money and side laying wiper. In the next clip, we have the side laying wiper, which can be performed with no weight to start and get comfortable. And as you get more comfortable, you can add more weight. Yeah. Banded no monies, you want to start with your palms facing the sky, keep your elbows in tight, and just move your wrists out, as the model is doing in the video. Subscapularis is the fourth rotator cuff muscle. The origin is the surface from the scapular fossa and the tendinous intermuscular septa from the subscapular fossa, indicated by the red star. And the insertion is the lesser tubercle from the humerus and the articular capsule of the shoulder joint, indicated by the blue star. Actions include medial rotator of the humerus, and it aids in pectoralis major and flexion of the abducted humerus. Exercises include banded internal rotation, 90-degree banded internal rotation, and band shoulder press. In this video, we have banded internal rotation, and you can also step out further to create more of a resistance, which would be the same as adding more weight.
Okay, so next we have the rectus abdominis. The origin is the crest of the pubis bone, which is down here with the red arrow. And the insertion is onto the xiphoid process of the sternum and the costal cartilage of ribs 5 through 7, which you can see here with the blue arrows. The actions of this muscle are flexion of the trunk, which moves the body between the rib cage and the pelvis. And an exercise you can do to work this muscle is crunches. So a weighted option also for this is a weighted plank, which you can see here. You can do with or without weight. This model here has weight on her back to make it a more intense exercise. And then as previously mentioned, crunches, again, this is done unweighted and works the rectus abdominis. Next, we have the transverse abdominis with the origin in the inguinal ligament, the iliac crest, thoracolumbar aponeurosis, and the internal surface of the costal cartilages 7 through 12, which is explained and described over here in this image, with all of those origins listed with the red arrows. Then the insertion is the abdominal aponeurosis and the linea alba, which is shown with these blue arrows to the side. The actions of this muscle include contracting and steadying the spine to provide support to the body, and it stabilizes the spine and the pelvis before lower body movement. An exercise for this is a side plank or a Pallof press, which is shown in the videos following. So the first is the Pallof press. This is used with a band of any resistance that you choose based off of your goals or like training program. As you can see, you extend the arms out and feel that tension with the arm with the band.
And then we have a side plank. This is a body weight exercise to work this muscle group, and can have weight added if you choose. And then next we have the external obliques. The point of origin is the exterior surface of ribs 5 through 12, and the insertion is the iliac crest and pubic tubercle. So the actions of this are lateral flexion, anterior flexion, and rotation of the trunk. Some exercises to strengthen this muscle are bicycle crunches or suitcase carry. So the weighted option is the suitcase carry, and it's just holding a weight to the one side of your body and just walking. And again, you can choose your weight depending on your personal preference and ability. And then next we have bicycle crunches. So this engages the external obliques through the movement of the opposite arms and legs in this motion as the model shows. Okay, and finally we have the internal obliques. The point of origin is the inguinal ligament, the intermediate line of the iliac crest, and the thoracolumbar fascia. The insertion is the crest of the pubis, the linea alba, and the costal cartilage of the bottom 4 or 5 ribs. So that's ribs 8 to 12. The action of this muscle group is lateral rotation, lateral flexion, and flexion of the trunk. Some exercises to work this muscle group are plank hip dips or Russian twists. So Russian twists is the weighted option, which is shown in this video. By moving side to side with a dumbbell in your hand, it works this muscle group. And then here's the example of plank with hip dips. This is a body weight exercise and works those obliques. Okay, and then this is just a diagram showing the difference of the abdominis muscles because there's a lot of like crossover. I thought this was a good visual to show like the differences on the actual human.
And now we have the iliacus major. So the origin of this muscle is inside of the pelvic bowl. The insertion is the lesser trochanter of the femur, shown on the side, like with the stars. Actions include flexion and lateral rotation of the thigh at the hip joint. Some exercises include the glute bridge, a military sit-up, and with the military setup, you have to have a partner hold your legs, and it's the movement coming from the hip coming when you go up. So shown in this video, it's a weighted glute bridge. You can do these unweighted, or you can adjust your weight according to your needs and your ability. And then the military sit-up. So with this, you have to go all the way up in this motion, and it's targeting your abs as well as the iliacus major on the side of your hip. So the psoas major, the origin of this muscle is the vertebrae of T12 and L5. Also, the insertion is the lesser trochanter of the femur, picture down below. Actions include the hip joint, which is a flexion of the thigh or trunk. This also includes lateral rotation of the thigh, lateral flexion of the trunk, and then some exercises include a kneeling lunge stretch. This is a deep lunge stretch, and it can target the side of the leg as well, and then also a glute bridge. So here again, we have the weighted glute bridge. Similar to the last video, you can adjust your weight if needed, or you can do these unweighted as well. And then the kneeling lunge stretch. So with this video, you want to have a deep lunge in this position, and it targets the side of the hip, and you can adjust it weight if needed, or depending on your mobility in your hip. And then here are credits. We use the SMAC Fitness Center, and then our participants are listed below.